Is it okay for us to record this conversation
Yes,
today?
it is.
Okay. Today Jimmy is here scheduled for an L34 Vertiflex, which is a interspinous distraction device which allows him to decompress the L34 inner space. Jimmy, have you had some injections in the past?
Yes,
Have they worked for you?
they've helped.
And how long do those typically last?
About 2 months.
And what happens after that? Are you back to the same?
I go to hurting.
And what's your usual symptom?
Well, it'll just my lower back, right down in there. When I bend over, straighten up real straight, and I work. You know, I have a tree service. I work and I work out of a bucket.
Yes, sir.
And it's hard anymore for me to reach out of the bucket and
Stand up.
hold and stand up and hang on to
So as
stuff.
soon as you stand up, you start having back pain.
Yeah.
And when does it go down the leg?
When I lay down at night and turn on my right side, that's when it goes down my leg. And
What about when you stand up and arch backwards and they start going down your leg?
Yeah.
Does it go down your leg immediately?
No, it takes a few minutes and then it'll go down.
Okay. But your pain that goes from your back to your leg when you arch backwards.
Yeah, when I arch back.
And that's your biggest issue.
Yeah.
Does it ever go into your hip and groin?
Yes,
Which
in my
side?
hip, right side.
And is that worse when you're trying to stand in and out of a chair?
Mm-hmm.
Okay. And when you have those injections, do all those symptoms get a bit better for a
Yes.
few weeks?
Yes.
And how
They-
many of those injections have you had in the past?
I've had 3.
3. And who did those injections?
You did here.
Okay. And do you take any blood thinners whatsoever?
No.
Okay. Have you been to any neurosurgeons or orthopedic surgeons to get your back evaluated?
No. Well, Dr. Beard, you know, they sent me to him and they sent me over here.
And he's a neurosurgeon.
Yeah.
Did he offer you any solutions?
Yeah, back surgery.
You wanted to do a fusion surgery?
Yeah, and I didn't want that.
Why did you choose not to have formal back surgery?
I didn't want it. I've seen it done too many times on a bunch of my buddies. It ain't never worked out that good.
So it was scary for you.
Yeah.
Do you have any health problems that would prevent you from having a major operation in your back as well?
No.
You could otherwise have a major
Yes.
back surgery.
Oh,
You're
yeah.
just choosing not to.
Yeah.
I understand.
I'd rather do this.
And is it okay once you're sedated and we come back to the recovery room that I ask you a few more questions?
Yes, it is.
Even if it's okay that you don't remember it?
Yeah.
And then I'll look at it with you in the clinic later in a few weeks.
Okay.
And review how successful this program has been for you. Is that okay?
Yes.
And is it okay to share this conversation, this video with other people who may
Yes,
have back
it
pain
is.
like this? Okay. Thank you, sir.
Uh-huh.
Appreciate it.